Restless Leg Syndrome, or RLS, is a sensory-motor disorder that causes uncomfortable sensations in the legs and an uncontrollable urge to move them, especially at night or during periods of rest. Most commonly affecting middle-aged individuals, RLS can disrupt sleep and daily life. While the exact causes remain unclear, researchers believe a mix of genetic and environmental factors play a role. Some cases are primary, meaning they occur on their own, while others are secondary, developing alongside other medical conditions or as a side effect of certain medications. Understanding RLS is crucial, as it impacts not just physical comfort but also overall well-being. Argentina, previous research found that RLS affects about 20% of the population. However, little was known about how RLS relates to sleep quality, mood disorders, or even the habit of sleeping with pets. This study set out to fill those gaps by exploring the presence of RLS using two validated Spanish questionnaires. The researchers also aimed to examine how RLS connects with factors like age, gender, medical history, medication use, and lifestyle habit. By gathering this information, the study hoped to provide a clearer picture of RLS and its broader impacts. Research team conducted a cross-sectional observational study, using anonymous, self-administered online questionnaires distributed via social networks and email. Participants were informed about the study's goals and assured their responses would remain confidential. The survey period ran from March 1 to April 1, 2023, just before the official end of the COVID-19 pandemic. The study used convenience and snowball sampling, meaning participants could invite others to join. This approach helped reach a wide range of people, though it also introduced some limitations such as potential selection bias. To assess RLS, the study used two main questionnaires: the single-question survey RLSQ-1, a quick yes-no screening tool, and the practitioner's RLS screening questionnaire PRLSSQ, which includes several criteria for diagnosis. Sleep quality was measured with the Pittsburgh Sleep Quality Index (PSQI), while mood disorders like anxiety and depression were evaluated using the Patient Health Questionnaire 4 (PHQ-4). The survey also collected information about participants' age, gender, medical history, medication use, and whether they slept with pets. These tools provided a comprehensive look at each participant's health and habits. A total of 2,081 people took part in the study. The average age was 38 years, ranging from 16 to 86. About 71% of participants were women, and more than half lived in the Buenos Aires metropolitan area. The survey also revealed that 14.5% of respondents were obese, 2% had diabetes, and 2.4% had sleep apnea. Notably, nearly one-third of participants reported sleeping with pets, highlighting the relevance of this lifestyle factor in the study. The study found that 11% of participants met the criteria for RLS using the RLSQ-1 questionnaire, while 14.8% did so with the PRLSSQ. These numbers are slightly lower than previous estimates, but still indicate that RLS is a common issue. The difference between the two questionnaires suggests that how RLS is measured can influence reported prevalence. This highlights the importance of using multiple tools for a more accurate assessment. Striking finding was the strong association between RLS and poor sleep quality. Nearly 70% of all participants reported poor sleep, and those with RLS were much more likely to fall into this group. Both RLS questionnaires showed that people with RLS had longer sleep onset latency, shorter sleep duration, and more sleep disturbances. This connection underscores how RLS can significantly disrupt restful sleep, affecting overall health and daily functioning. The study also explored the relationship between RLS and mood disorders. Using the PHQ-4, researchers found that 46% of participants had symptoms of depression and 28% had symptoms of anxiety. Both questionnaires indicated that people with RLS were more likely to experience these mood issues. This suggests a possible bidirectional relationship where RLS and mood disorders may influence each other, potentially through shared neurobiological pathways. Medical history played a significant role in RLS risk. The study found that diabetes, sleep apnea, and obesity were more common among those with RLS. In particular, diabetes was strongly associated with RLS in the RLSQ-1 group, while sleep apnea was a key factor in the PRLSSQ group. These findings align with previous research, suggesting that managing underlying health conditions may help reduce RLS symptoms. The study examined how certain medications and substances might influence RLS. Participants who used benzodiazepines or cannabidiol (CBD) drops at least once a week to help with sleep were found to have a higher risk of RLS, according to the RLSQ-1. While these medications are sometimes used to manage sleep problems, their relationship with RLS is complex and not fully understood. This highlights the need for careful consideration when treating sleep issues in people with RLS. One of the most unique aspects of this study was its focus on co-sleeping with pets. About 32% of participants reported sharing their bed with animals. Interestingly, the PRLSSQ found that people who slept with pets had a lower risk of RLS. This suggests a possible protective effect, perhaps due to the psychological comfort and routine that pets provide. However, the study did not ask about the type or number of pets, so more research is needed to understand this relationship fully. The study found that women were more likely to report RLS symptoms, especially when using the PRLSSQ questionnaire. This aligns with other research showing that women are affected by RLS about twice as often as men. Possible reasons include hormonal differences, pregnancy-related changes, and a greater tendency for women to report symptoms. Understanding these gender differences is important for tailoring prevention and treatment strategy. Like any research, the study had its limitations. The use of online self-administered surveys meant that only people with internet access and digital skills could participate, potentially excluding some groups. The sample also had more women than men, which may have influenced the results. Additionally, relying on self-reported data can introduce inaccuracies. Despite these challenges, the study provides valuable insights into RLS and its association. Despite its limitations, the study stands out for several reasons. It was the first in Argentina to examine the relationship between RLS, sleep quality mood disorders, and co-sleeping with pets. The use of validated Spanish questionnaires ensured reliable data collection. By exploring new variables like pet co-sleeping, the research opens doors for future studies and potential interventions to improve sleep and well-being. In summary, this study highlights that RLS is a common and impactful condition in Argentina, closely linked to poor sleep quality, mood disorders, and certain medical conditions. The surprising finding that co-sleeping with pets may reduce RLS risk adds a new dimension to our understanding. While more research is needed to confirm these results and explore underlying mechanisms, these insights can help guide better diagnosis, treatment, and lifestyle recommendations for people living with RLS.